the mission that I've found at Trillium when I came here is to care for our most vulnerable people and make sure that we're interactive in our community. I'm Dr. Jeannie Savage, Chief Medical Officer at Trillium Community Health Plan. It really does take a dedicated group of compassionate people working in a very coordinated way to make a difference every day.
Without Trillium's help, we probably would not be achieving the level of care that we do achieve in our communities. My name's Dr. Joseph Volpe, and I'm the Medical Director for Orchid Health. Healthcare is a right and not a privilege, and in order to treat it as a right, we have to assume that we can give the same quality of life and the same health to all individuals. And that's going to mean allocating resources effectively in order to achieve that goal. Trillium is a solution to that equity.
One of the things that we've been working with our partners on is health equity. And Trillium Community Health Plan has been a leader in the field of health equity. What I found at Trillium is that they want to treat the whole person, not just physical health, but behavioral health and oral health.
From a provider perspective, trust is the single biggest benefit, and that's what Trillium does. They're investing in social capital in our communities.
It's essential you work within that community with the preferred language that people want to speak, to educate, to make sure that they seek out care in an appropriate fashion, and to make sure that we are offering those services in the areas where they live. Trillium recognizes that development and interaction within the community and active relationships within the community are essential. If that's our member, wonderful. But if we can provide services and if we can help those providers care for a multitude of people, we understand that the greater good is where we want to be.
Trillium is by far the most down-to-earth and integrated CCO that I've had the pleasure of experiencing.
Healthcare is a right. We have a responsibility to provide healthcare equally to everybody here. Not just our members, but our community. And if we can provide that education about where people come and have those discussions openly and honestly, then I think we're doing a good job.
Trillium truly cares about the individual in its plan. Each individual it has a vested interest in and wants to make their life better.